Kia ora, good evening. The West African nation of Liberia has been ravaged by the Ebola epidemic since its first case in March last year. The country has just been declared Ebola-free, but not before 4,800 Liberians succumbed to the virus. Yet there are numbers that haven't been included in that total, those who died not of Ebola, but because of it. 60 Minutes travelled to Liberia to meet New Zealand doctor Penny Milsom. The 31-year-old was recruited to work in an Ebola treatment unit 9 months ago. But upon arrival, she found it wasn't Ebola that was killing Liberians, but a health system that was lethally inadequate. Redemption Hospital lies in a neglected corner of Monrovia, the capital of Liberia. It's the only public hospital in the city. In the height of the Ebola epidemic, this was the epicentre. Dr. Mohammed Sanko is the medical director.
It is only by God's own intervention and grace, you understand, and compassion, that some of us, today, we are able to tell you the story.
A year ago, this hospital was converted into a holding centre for the infected. 400 people were crammed into a 205-bed facility.
During that time, it was between life and death, my dear. Even we who brave it, before ever you come to this ground, you start thinking, what precautionary measures am I going to take? Which areas am I going to go to in the hospital? Which areas am I going to touch?
Liberians living near the hospital say it's cursed. They've stoned the building twice in the last year. Eventually, everything inside these concrete walls was abandoned. The hospital simply too contaminated to carry on.
The whole situation was very, very overwhelming for us. Very overwhelming.
In November last year, New Zealander Penny Milsom set foot in Redemption Hospital for the first time.
What was the blood glucose level for this baby Kia?
A surgical registrar from Auckland's Starship Hospital, she had just finished a Masters in Public Health at Columbia University. The 31-year-old wanted to put her study into use at an Ebola treatment unit. What did your family and friends say when you said you were going to come here?
There were a lot of people who said I was crazy. There were a lot of people.
But by November, Ebola was waning. At the peak of transmission, the country was reporting up to 400 new cases every week. By Christmas, it was just 31. Liberians celebrated, but Penny realised a great oversight.
Once the heat came out of the situation here and people had a chance to stop, people weren't picking up 20 bodies a day anymore, and there was time to think about what else was happening. There was an opportunity to stand back and say, shit, the regular health system's just collapsed.
How many people died during Ebola of non-Ebola illnesses?
I would imagine that, there would have been a lot of hidden mortality that's not from Ebola.
In the thousands?
Oh yeah. Yeah, absolutely.
And of what kind of illnesses?
The usual things that kill people in a place like this.
With Liberia's hospitals converted into Ebola treatment units, there was a complete lack of care for all other patients. Liberians who needed medical help had nowhere to go.
You hear stories of women who were seeking care in multiple places. Nobody would take them in, and stories of the woman who gave birth on the side of the street and the baby dies. And you hear that a lot.
The New Zealander was recruited by the International Rescue Committee. Her team decided on a new mission. Instead of opening another Ebola treatment unit, they would reopen Redemption Hospital. Take us back to when you first walked through the doors at Redemption Hospital.
Yeah, it was very eerie because nobody was there, and you could feel the weight of, what had happened there. It was like a ghost. It was a ghost town.
Penny chose to work in the paediatric unit with the most vulnerable of patients.
No one had ever done this before, and certainly nobody here had ever had to do this before. So there was a lot of kind of feeling like we were making things up as we go along, and that sounds irresponsible, but it was just like, how do you reopen a hospital in the middle of an epidemic? Like, how do you do that?
Staffing was a major issue. Before Ebola, Liberia had the worst ratio of physicians to population in the world. The same size as New Zealand, World Health Organization data shows, at last count, we had 11,700 physicians. Liberia had just 51. Ebola fueling an already desperate shortage.
Healthcare workers were being exposed to just, they were putting their lives at risk there. So they, healthcare workers didn't want to go to work. There was issues with being paid. Community was at times, stoning the hospital. So there was a lot of security issues. There was a lot of distrust between healthcare workers and the community and vice versa.
One of the first challenges was deciding who to allow in the doors. They still couldn't admit a lot of patients for fear of Ebola. Penny's practical experience was largely in New Zealand. She'd never seen a sick patient turned away from a health facility.
It's tragic that people get turned away from hospitals. It's tragic that when they come to hospital, they don't get the care they need immediately. Or that there's no doctors, or when you run out of simple things like fluid, or you run out of antibiotics, and you just have to say you don't have any.
It was this she struggled with the most.
It just seems very unfair a lot of the time. Very unfair that that these people have such limited health care.
The lack of resources here is hard to comprehend. Power, water and medication are unreliable. Today they're running low on oxygen. For a patient to receive oxygen, they have a cylinder placed next to their bedside. When it runs out, they must take a tank from a different patient or wait for a ute to arrive with fresh supplies. While we were filming, one of those trucks arrived. 4 fresh oxygen tanks for 4 lucky patients.
We have very limited supplies of lots of things, and oxygen is one of them. And at the moment, where we are in the paediatric department, we have 3 oxygen cylinders, and so you have to decide which child needs this oxygen the most right now.
The World Health Organization declared Liberia Ebola-free last month, but precautions are still in place. Penny wears protective clothing, a face shield, cap, gloves and a disposable apron. And until recently, there was a no-touch policy.
The hardest thing for me has been the no-touch, and how can you give care to a patient when you're not allowed to touch them? And that's been that's really hard.
Have you ever put yourself at risk of Ebola?
I've had one case where where there was some concern about a patient, and then unfortunately that patient died, and I touched the mother. That was the only humane thing to do, was to show some care and concern, because she was very, very alone at the time. That interaction was all I thought about, and then it wasn't until later that I realised that you're such an idiot. You can wear protective equipment and manage the child, but then you go and touch the mother who's been holding the baby. It's just like.
She was reprimanded by her colleagues for putting herself and others at risk. 12 staff members had already died.
It's even worse than HIV/AIDS. So this disease kills as fast as possible.
Everybody's got a story, or has lost someone, or multiple people. There are whole families that have been destroyed.
The fear around working in this environment, living with the constant threat of Ebola, takes a toll on Kiwi doctor Penny Milson. How do you escape?
I don't know. It's quite hard to escape. You can't escape. You can't escape. You can't really escape what you've seen, what you've done.
There's few people to talk to about the burden of her job. She has seen the nurses here numbed by pain.
When they see bad things happen a lot, which bad things happen a lot, you know, they must protect themselves by becoming somewhat hardened.
The fear of another outbreak is constant. Reminders of the virus reach you at every entrance. During the crisis, Redemption Hospital was shut down because it became a cesspool for Ebola, leaving many people with Ebola or otherwise stricken outside. Now it's reopened, but Ebola is never far from mind. Everyone who comes in here has to have their feet disinfected and their temperature taken. And at doorways throughout the hospital, there are hand washing stations with 0.5% chlorine.
This area was an epicenter for the Ebola.
Is there concern Ebola could return?
Oh, yeah. I mean, it's across the borders, so we can, it's, you know, Sierra Leone and Guinea still certainly reporting new cases. So, yeah, it's a huge risk. I mean, how can you control everybody that crosses the border? It's impossible.
That's why authorities have kept Ebola facilities open across Monrovia. Next to Redemption Hospital is an Ebola transit unit. This one opened in September. They had their last patient here in March. It was actually the last patient of Ebola in Liberia. She did die, but they have kept it open just in case. We're going to go inside and have a look around and see how they operate. This is a holding centre for patients who come to the hospital with symptoms characteristic of Ebola. It takes at least 24 hours to discover if they're positive. Dr. Abu Bakar runs the unit.
And we call it the red zone. So it is a high-risk zone.
The protocols here are rigid. Each patient is quarantined and questioned about who they've been in contact with. This process, called contact tracing, found more than 1,500 people who had been exposed to the facility's last patient, all of whom had to be tracked down and monitored. Why have you kept this unit open?
Redemption Hospital, it is the only free services in Liberia, and sometimes we receive patients coming from Guinea and Israel.
It's the possibility Ebola could return and the memory of what happened here that has people hesitant to return to the hospital.
Everybody was afraid. The community afraid to bring patients. So patients dying in the community. I hope you understand what I'm saying. The nurses are afraid to touch the cases. And others, so there was apprehension everywhere.
Penny wanted to know why. She's found the community has created a parallel health system, local leaders stepping up as health workers to fill a gap left by rejection and fear.
During the Ebola outbreak, community-based healthcare providers stepped in and provided care to the community when the rest of the health system didn't. And certainly the international response didn't necessarily have that as a focus at all.
Today, she's meeting with pregnant women and midwives from a local community.
When Ebola started in Liberia,
Yes.
people were afraid to go to detention.
Yes.
She's turning these women into researchers, empowering them to find their own solutions. Pregnant women really suffered through Ebola?
All these people were, I want to say forgotten, but I don't think that's entirely fair because there was a huge demand to control the epidemic at the time, but those people suffered immensely during the outbreak.
Before Ebola, Liberia was already one of the most dangerous places in the world to give birth.
What we would like to do is find out from you your experiences, the problems you faced, and then work with you to develop a plan of action that we can help you implement in the community to make changes, positive changes in the system.
Their hesitation to return to Redemption Hospital is palpable. At those doors, their loved ones died and their pleas for help were rejected.
People was afraid to go to the hospital because Ebola was there, but now Ebola is gone.
There are many complications, there are many problems. Even though you are saying that there is good care there, but there is no good care there. If I go, they may want me charge They may charge, or they may
overcharge.
yeah, they may overcharge. Sometimes you will go redemption, you will stay there from 6 to 6.
We've noticed that people are just not coming back to the hospital as we might have expected. Women don't necessarily trust the services of the hospital. They don't necessarily feel safe there. So if they would prefer to deliver in their community, then I think that we should find ways to facilitate that.
Right, instead of forcing them to go back to the hospital.
Yeah.
During the epidemic, midwife Mama G turned her home into a birthing unit for the hundreds of women rejected from hospitals.
All hospitals were shut down, and there was nowhere for our pregnant women to go and deliver. During Ebola, 50 plus a week. Sometimes in the daytime, 25 to 30%.
So this is where they deliver?
Yes.
Right. And then they rest here?
Yeah, they wait here for observation.
She says she delivered the babies of 5 women infected with Ebola.
I don't have no fear. Whenever they come, that time I be brave to do the delivery. I don't have no fear.
Penny believes it's people like Mama G who hold the key to resurrecting this health system.
We have ideas and we make assumptions about what you need. But really, you know a lot better about what you need. Mama G knows about what she needs, and you as pregnant women also know about what is best for you and what would work well for you.
I'm breaking down.
The health system now rests in the hands of women like these, patients themselves. And they'll be doing it on their own. Penny's heading back to New Zealand. One day she hopes to return and visit a community that will welcome her as their own.
I want her to feel like home. When she's with us, she's an African. Yeah, she's a Liberian. Yeah, because she works with us, she loves us, and so we love her also.